Miss Jones. My name's Colleen. I'm going to be your nurse today. Did I just see your doctor leaving your room?
Yeah, he just left. He told me that I have HIV, and I'm really blown away. I never suspected that I had it. He thinks I may have gotten it from a blood transfusion that I had several years ago. But I was tested for HIV after that blood transfusion, and I didn't have it. How could it be positive now? Could my husband and kids have it too?
Stop. How would you respond to this patient's questions? I understand that you have a lot of questions about your diagnosis. In terms of the tests they do for HIV, you could actually have been tested after your blood transfusion and had a false negative. The tests that they do for HIV test for antibodies in your bloodstream, and if it had not been long enough since you were exposed, you would not have developed the antibodies and your test would have been negative. In terms of whether your family could catch this virus from you, anybody that you've had sexual contact with could have a chance of contacting the virus and they would need to be tested. HIV is not spread through casual contact, however, so your children are unlikely to have contacted the virus. But your physician will probably test them anyway, just to be sure. I understand that you're upset about all of this information that you've been given.
How can they be sure that I even have it? Maybe they should just redo the test.
Stop. How would you respond to this patient? There are several different tests that they do to determine if someone has HIV. The first test is just a regular blood test where they test for antibodies in your blood. If you've been exposed to the virus and your body's had time to develop the antibodies, you will test positive. With this type of test, they repeat it once, and if it's positive, then a confirmatory test is done. The newer tests are called rapid HIV tests, and those only need to be done once if they're positive. That's also a serum sample that they drew from you. If it's positive either way, then the Western blot needs to be done. This is really the confirmatory testing so that we can make sure that we have the right diagnosis. And it sounds like your Western blot was positive for HIV.
So it sounds like they're pretty sure I have the virus. I was afraid to ask the doctor because I am afraid of the answer. Does that mean I have AIDS?
Stop. How would you respond to this patient? There are several different stages of the HIV virus. The primary infection is from the time you're exposed to the virus until we're able to detect antibodies in your system. You then enter the HIV asymptomatic phase. Your body's able to compensate for the virus, and this can last several years, and you should be able to carry out your activities normally and not feel ill. Once your bone marrow begins to tire and is unable to make enough lymphocytes to counteract the virus, we call this HIV symptomatic, and you probably will start to develop some infections which will make you feel ill. They will monitor your CD4 count and your viral load. Once your CD4 count drops below 200 cells, then we consider this AIDS.
So are they going to give me some medicines to kill this virus I have? And if they do, how will they know if the medicine's working?
Stop. How would you respond to this patient? Yes, your doctor will prescribe medications for you to take to combat the HIV. There are different schools of thought of when it's best to start medication, but most physicians now will start these medications at the time of diagnosis. We call this antiretroviral therapy, and generally you will take 3 different classifications of drugs or 3 different pills every day. It's really important that you take your medication at the same time every day because the virus can mutate very rapidly. Also, the medications are really expensive, so we may need to get social work to help and look at some of the financial aspects of it. There are some side effects to these drugs that we can talk about later when you actually start the therapy.
Wow, I'm so glad that I spoke to you. Is there anything else I need to know before I go home?
Stop. How would you respond to this patient? Really important question, and I'm glad you asked it. We've given you a lot of information today. Before you go home, we'll make sure to sit down and talk again about everything that you need to know when you're discharged, and also give you some written information that you can look at when you get home. Just a couple of things. We will need to arrange for your family to be tested for HIV. Also, in general, when you get home, it's just really important to live a healthy lifestyle. That will include a healthy diet, getting plenty of rest and exercise, and minimizing stress as much as you can. You'll also have to be very careful that you aren't exposed to anybody that's ill, because you will be more likely to catch an infection. I'm really glad that we had this talk today, and I know that you probably have a lot of questions and your family may have more questions, and I'll be happy to answer any questions that anybody has.